Okay, I think we're live. Hi, everyone. Thanks for coming to the panel session. We're here to ask a few questions. If you click on the box on the right that says questions, you can ask a question. Any question you're interested in, I will ask the panel, or they can read the questions, but I'll read it out loud. I'll start with a few questions of my own. Those were all really excellent presentations. Thank you all so much for participating. Dr. Paller, maybe start with you. I found your research extremely fascinating. Of course, I'm very familiar with it. We've worked together a lot. But I wonder, on the specific topic of living review, which is what you brought up at the end of your presentation, how do you think that prostate cancer and the precision medicine approaches you were talking about why is living review well suited to that? Why is it a better approach than a standard systematic review?
We're going through an exciting time in prostate cancer research where we've just got 2 new targeted therapies approved in prostate cancer, and the FDA approved 15 genes that they claim are actionable based on that composite endpoint that I noted, which included CTC conversion from more than 5 cells to less than 5 cells. But what we're learning is clinically in real life with our patients, that's not always true. So I mentioned CDK12, and some other genes that ATM that are just not responding to these PARP inhibitors like we thought they would. And so it is essential that we keep track of these in sort of a real-time fashion. Just to name a few others, we've learned that SPOP causes a great response to just plain old hormonal therapy. We know that this, back in March, LRP1B has a great response to immune therapy. And so it's hard to keep track of the literature and know how to treat your patients with these rare mutations. And we have all this data coming in. Every patient now is sequenced. It's standard of care to sequence both their germline and somatic mutations. And so it's really important to have continual reviews to educate patients, clinicians, and researchers to know what these different mutations mean for prognosis and predictive value to treatment.
So more on the specific research you presented side and a little bit less on the Sysrev side, I find the idea of mutations driving therapy decisions quite fascinating. I think you're describing some situations where mutations already drive therapy decisions. Are you saying that there's a future here where there are mutation-specific combinations of drugs we're giving patients? Are there certain mutations that dominate decision-making right now? And is that a fact of the biology, or is it just that we haven't done enough research to discover all the important mutations out there?
That's exactly the research we're doing right now. So if we know that a patient has a germline BRCA2 mutation, we'd be delighted to give them a PARP inhibitor and be very excited that they're more than likely to respond to the therapy. However, if the patient does not have that mutation, there are trials ongoing that combine PARP inhibitors with immunotherapy, with hormone therapy, because there are synergistic pathways. But that will be more of a cocktail for people who don't have specific targets that are driving their cancer. And so both are going to be true, both a targeted approach for people who have a single driving mutation, and for those who don't, we'll have to have more of the cocktail approach.
Very fascinating. Thank you. Dr. Wayne, the nanoparticle and macrophage systematic review you've actually split that across a couple of projects. Can you talk to that decision about splitting it across projects, and did that make the project more challenging? Why did you decide to do that?
Oh, across, you mean as a title abstract and then full text screen and then?
Yeah.
So I think that was more of a method. I mean, I considered it the same project, but it's, we were just trying to screen the number of papers that we actually looked at. So the title and abstract was a shorter, that's maybe 300 words to look for the manual text part where we were assessing the data to see if it actually fit the criteria, and then doing the text, the larger text. And I think it was also a decision that we made because it follows what a traditional systematic review would have been like without the machine learning.
Yeah, that's you talked about that a little bit. I think that's really interesting that the standard guidelines are sort of that title abstract screening and then a full data extraction. And that makes sense to split it up into separate projects because of that. When you were integrating machine learning into this process, did you find that there were places where that process didn't work very well? You mentioned this actual explicit sort of analysis you did to look at specific decisions the models made. Yeah, can you talk about that at all?
So we got to, there's a point where we thought, okay, seems like there's a really nice histogram. If you've seen the Sysrev platform, you kind of know what I'm talking about with the prediction values. And one thing we wanted to think about was, how do we trust? What do we do to trust? So we thought this is our first foray into looking at this kind of data. So it was probably like half let's do something traditional, and half let's verge into this new set, and then maybe we'll trust it fully the next time we do this. But what we did was we just took maybe 40% and downward and looked to see how often was our human judgment correlating with what the percentages were. And what we were finding was, it was weird, because even at 90%, we would still occasionally get papers that like, that's not what we thought it was at all.
We have a little more work to do, I suppose. Yeah, but that's good
But
to
on
hear.
the other hand, that 40 to 60 range was like, we got to still look at these, because it was like more of those were still relevant, whereas we kind of could say 40, maybe, so 39 and down were like, oh, like, how the heart paper get in here? Like, why did atherosclerosis make it into our cancer paper? And I think that was also the interesting thing as we were pulling these words. So tumor-associated macrophage, we also said TAM, but TAM also stands for tamoxifen. And so we were getting papers that were talking about tamoxifen and not about TAMs. Or NF-kappa B, or tumor necrosis factor, is a cytokine that is used to, is associated with polarization, but it also could be just TNF alpha. And so that was another way that we were getting other diseases and put it into our review. So I think there were just cross labs that not necessarily was an algorithm challenge, but kind of like, what we think is that a word pickout may not have been as useful as a context pickout of the words.
Yeah, that does go to a little bit about how the algorithm works, and we've written a little bit about that. But maybe there are ways we can upgrade it to improve it and address some of the things you just brought up. I know you also worked with Sarah Young, who's a librarian, and librarians can be really passionate in this space. We really should have a librarian on here. Hopefully in the future we can. I wonder if you could talk about that a little bit. Did the platform make it easier to collaborate with other people, particularly with librarians? Do you see ways that we could improve that process?
Yeah, I mean, I think if you guys have time afterwards, I think she's actually in the webinar. And yeah, I mean, I reached out because I thought that they would have more expertise in this kind of thing. I took it as, I don't want to do this wrong. Just because I have a great idea doesn't mean that my idea, that I won't apply it horribly because I'm going into a different field. So the Sysrev platform was something that Dr. Young suggested, and that we all did. And it actually made it really easy to give certain access to the students, to kind of measure things, to see how things are going, to actually go back and like, okay, so look at kind of the minor data details of like, these pairs are always seeming to not agree, or what's kind of happening, or like, why is it this person's not doing as many? Because sometimes it was like we need to talk about how we're making decisions and how we're doing things in the platform itself, that made that kind of discussion possible, because there was like built-in data. And it wasn't always data you would probably not just to accept and reject or decline, but those, which paper, who viewed it. Oh, let's look at that paper, that exact decision together again, because you said you were confused about it, and we could do that because there's ways of tracking it.
Yeah, so you actually looked at a student or a researcher, you saw a paper they reviewed, they were confused about it, and you could go and look at that paper together. That's awesome.
Or if they asked me, could they come back and do that? And so like they were confused. And I think you're going to talk to Dr. Mirza next, but what was interesting about this was that I effectively was the most qualified person on the group, and that I've been looking at cancer for like 10 years. And the students were basically like, what is they were learning on the job. And so there were times where they knew how to assess things, but they didn't really have context. So to know like, oh no, I can identify in probably a minute or less that like, no, okay, that's not this for this other complicated reason. But they just don't have the context to know. They don't know how crazy our field is, because they don't know my colleagues, right? but they know English and science. And so that was really interesting to see how they gained skills over time, but how I also had to kind of help. I was a tiebreaker in many instances to help with those very types of like, I didn't think about that. And it wasn't until that came up that I realized that there's a reason why the students weren't going to get that one, that I could not have possibly explained, and that were not going to be very clear from the review criteria.
Okay. Thank you, Dr. Wayne. Dr. Mirza, I think we're going a little over time, so I'm trying to manage two things at once here. But Dr. Mirza, that's fine, by the way. We still have 5 minutes, so don't feel rushed. And I really want your answer to these questions. You're explicitly curating a database, which is a little bit of a different task. I wonder if you can speak to the differences in your strategy and you're evaluating the outcomes of a review. How do these things differ when you're creating a database versus doing a traditional literature review, or even some of these other forms of systematic review?
Yeah, this is more of a this is a crowdsourced data gathering exercise rather than being close to a systematic review, isn't it? So the main thing for us is making sure that as much of the literature is reviewed as possible, that we don't miss anything out. As much as is possible, there will always be instances where things do get missed out, and the data that's extracted is as accurate as possible. So it's not so much kind of integrating and integrating the data or simulating the data afterwards, as you might do in a systematic review, or coming up with kind of an overall effect size or overall p-value, but it's a question of just making sure that as much of the data that we need for the database is extracted and nothing is missed out. So
completeness is a really important part of this for you.
Yeah, absolutely. I mean, that's the aim. Obviously, that's never really possible. There will always be things that are missed out. But what we're trying to achieve, a database like this can be used in a number of different ways. But the way that I envisage it in particular is actually trying to form as complete a picture as possible of the genes and proteins which are underlying epilepsy. So it's forming a universal or complete picture, so that then you can try and identify which genes, which genetic pathways are most central to the disease process. And if you have pieces missing from the picture, then it's difficult to form that. It's difficult to identify what's most central and what's most important. So being that comprehensive in that way is something that is important for me. But other people could equally look at the database and just see or find one or two genes which are of interest to them and go from there.
I love that idea of reuse of the data. So you're building this database and you have a specific use case for it. You want to be complete in identifying those genes. Are any of your colleagues looking at other use cases for that database? Do you have a good way to share that data with other people?
So I'm sure what we've made databases, crowdsourced databases in the past and published them, and people do use them in different ways. People obviously have different views of how they might make use of them and how they look at them. So I'm sure that people will be. So what we're trying to do is we're trying to create a database which actually covers not only different types of epilepsy, but also different species, which is quite unique. So also there are many gene and protein databases for different diseases, but to the best of my knowledge, I've not come across databases which combine data for different species. So we include data for primates and rodents and flies and worms and zebrafish, and again, that's a part of our trying to be as comprehensive as possible. So I hope that it will be clinical researchers and basic science researchers, researchers working with rodents or primates or other other animals, they'll all be able to find something in that database as a starting point with which they can use to take the research forward.
So thank you very much. I've noticed we don't have any questions coming in from the audience. If you have any questions for this group, now's your opportunity. I know we have a very small audience, so this was a possibility. I don't want to take up too much of our speakers' time, so maybe just give you guys a few seconds. Any burning questions? Okay, the question is, I'm really interested in the pedagogical aspects of systematic review for undergraduate students learning how to read and do research. We saw these same benefits in the macrophage project. Does Dr. Mirza have any other ideas for how this kind of work, it looks like it's cut off maybe, for how this kind of work can be used or could be incorporated into normal coursework or undergraduate research experiences?
Yeah, so I'm sure the way the courses are structured are different in different universities and different courses, but it can. So in our in the kind of courses that are done in our university for undergraduates, so they're not doing research degrees, but they tend to have modules or particular parts of the course in which the aim is to teach them research skills. So I think a project like this certainly has lots of advantages. The accessibility is an advantage, that people can do it remotely, and obviously the circumstances with the pandemic that we find ourselves in, that presents a significant advantage, but also in others, in normal times. So I think a project like this can be incorporated quite easily into small modules within a year, within a full degree or a full course. And certainly at our university, when the pandemic hit, and people found that we found that we couldn't really offer students some of the courses where they had to come into the lab or go into the clinic to do research, or couldn't offer them those research opportunities. So the university was actively looking out for projects such as this, and other projects where people could work remotely. So so I think there's certainly opportunities there.
Just to piggyback on that, and I think maybe this is the last question. If we end up running over time, the last webinar is me talking about features. You guys can skip that if you like. So I'm pretty curious. You've actually all talked about students a little bit. Dr. Paller, I know you've run a few smaller projects with really just a few medical students doing work on reviews. And I'm curious if you've seen that students really learn these topics better. Have you observed that their understanding of the topics improve just as a fact of reading a lot of these documents and having evidence of them reading documents? Is there a relationship between the number of documents students are reading and their understanding? Please, if any of you have comments on that, some of you have commented on that idea a little bit already, but anything else?
I would just resonate with what Dr. Wayne said, that it is more work for me, but it is amazing at the number of cases they get to go through and the opportunities for learning that each paper comes with. So over time, I do see them learning significantly more with more papers that they're willing to review.
Yeah, I've found that as well, and we found that the level of knowledge, the level of interest also in the subjects in epilepsy, in genetics, for example, in the case of my project, does increase significantly. I was actually having a meeting with a medical student the other day who'd taken part in the project, and she was full of excitement when she told me, I saw my first patient having a seizure on the ward, which is a little bit morbid, but it just illustrates the interest that's being generated in them for the subject area. So that's gratifying to see, and also I think it raises hopes that they're going to enter into research in these fields in the future.
Yeah, so I think this is interesting and something that tangentially was also really great to have the librarians on staff for, because the educational aspect clearly became like an interesting point, but also a separate, like maybe to be investigated. And that means IRB because we can't just start asking us these questions and then trying to like stop them and, like put them in a box and look at them. But what I did notice was that is it computation? Their computer skills increased. So if I have PhD students and one of the first things you do is you find out how to study this technique, how to find this paper. Before this project, they probably would have just looked on Google and found maybe 2 papers. And now they come back with this like spreadsheet, and I'm like, how did you do that? It's like I know how they did it, but they clearly exceeded even my skill level in searching for papers and sophistication, for kind of knowing like, no. Now I have now found that in the world there's like 400 papers with this specific set of things. And then I'm like, oh, what about this? And they go, wait, let me look at it. And they just know how to change it. So I think their searching skill, their internet savvy skills have really dramatically increased. What I think will be kind of interesting to investigate is this idea of how much background information you need to know to really benefit in terms of knowledge of the material when you review these things. Mm-hmm. Because I would say that some people, there's a confidence that increase of reading papers they don't understand because they spend hours now looking at things they have no idea what they mean. But sometimes I also did feel as though they may not actually still understand to the level that experience and like maybe a little more like in-depth assessment gives them. So it might be interesting to say, what's the difference between someone who's got 1 year, 0 experience, a year experience, grad, med school experience with the actual topic, and then doing this kind of review? And then how many papers did it take? Like the Maxwell got 10,000 hours approach. So I think there's a lot of ways to kind of approach that in itself. To add more nuance to like, did they learn? I think confidence, the technical aspects, absolutely 100%. You can argue at any stage, no matter what background they had, they add and improve. But I think that like the return in value in terms of, do they understand all macrophages and nanoparticles? I'm not quite sure yet. And it's not expected, but
it'd be cool if we could use, the models, the data to sort of evaluate those students. But as you said, an IRB might be necessary.
Oh, so, it looked.
Okay, wow.
We don't want to mess this up. So it'd have to be done appropriately, but this seems like it could be interesting and across platforms and looking at assessing student skills. And certainly incorporate, there's different ways to do it, but we were looking into this.
Well, I hope you keep looking into it, and let me know if you want some help with that. So I think next time we have to make this session a little longer. Personally, I find talking to all of you really fun, and I think I hope the audience enjoys this as well. But I want to be respectful of people's time. So I think we're going to end the session now. Thank all of you very, very much. In the next session, we will have, I will be going through some announcements for Sysrev and a few feature updates. Thank you to all of our speakers once more. This has been really terrific. Thank you.
Thank you.
Thank you.
Nice meeting everyone.
Yes. Nice meeting you too.
Absolutely.